Have you ever heard of acute coronary syndrome, or ACS? It might sound complex, but it's a term for a range of conditions where blood flow to the heart muscle is suddenly reduced or blocked. This is a serious medical emergency, and understanding it could save a life, maybe even your own. Today, we're going to break down what ACS is, what causes it, how to recognize it, and what you can do about it. Stick around, because this information is vital for everyone. So, what are the signs of ACS? The most common symptom is chest pain, often described as aching, pressure, tightness, or a burning sensation. This pain might spread to your shoulders, arms, upper abdomen, back, neck, or jaw. But that's not all. You might also experience shortness of breath, sudden heavy sweating, dizziness, nausea, or overwhelming fatigue. It's crucial to remember that symptoms can vary, especially between men and women. Women, for example, are more likely to experience less obvious symptoms like shortness of breath or back pain without significant chest discomfort. This brings us to a critical point. When should you see a doctor? The answer is immediately. If you experience chest pain or any other symptoms that could signal a heart attack, do not wait. Don't try to tough it out or drive yourself to the hospital. Call your local emergency number right away. Every second counts. Paramedics can start treatment on the way to the hospital, which significantly improves your chances of a better outcome. Never underestimate these symptoms. It's always better to be safe than sorry. Now let's talk about what causes ACS. It usually starts with atherosclerosis, which is the buildup of fatty deposits, or plaques, in your arteries. These plaques can narrow the arteries over time. ACS occurs when one of these plaques ruptures or breaks open. A blood clot then forms on the surface of the plaque. If this clot grows large enough, it can block the artery and cut off blood flow to a part of your heart muscle. This lack of blood and oxygen is what causes the damage and the symptoms we've discussed. If left untreated, ACS can lead to serious complications. A heart attack can cause permanent damage to your heart muscle, which can affect its ability to pump blood effectively. This can lead to heart failure, a condition where your heart can't pump enough blood to meet your body's needs. Another potential complication is an arrhythmia, which is an irregular heartbeat. Some arrhythmias can be life-threatening. The key takeaway here is that prompt treatment is essential to prevent or minimize these serious complications. So, who is at risk? Several factors can increase your likelihood of developing ACS. Some you can't change, like aging, having a family history of early heart disease, or being male. However, there are many risk factors you absolutely can control. These include high blood pressure, high cholesterol, smoking, diabetes, lack of physical activity, an unhealthy diet, and being overweight or obese. Managing these risk factors is one of the most powerful things you can do to protect your heart health. When you arrive at the hospital with suspected ACS, doctors will act quickly to diagnose the problem. They'll likely start with an electrocardiogram, or ECG, which records the electrical activity of your heart. Blood tests are also crucial. They look for specific proteins, called cardiac troponins, that are released into the bloodstream when the heart muscle is damaged. These tests help doctors determine if you're having a heart attack and guide the treatment plan. In some cases, they might also perform a coronary angiogram, where a special dye and X-rays are used to see inside your coronary arteries. Once a diagnosis is made, treatment begins immediately. The primary goals are to restore blood flow to the heart, relieve pain, and prevent further complications. This can involve medications like aspirin to prevent blood clots, nitroglycerin to improve blood flow, and other drugs to manage chest pain, blood pressure, and cholesterol. In many cases, a procedure called angioplasty with stenting is performed. A tiny balloon is used to open the blocked artery, and a small mesh tube called a stent is often placed to keep it open. In more severe cases, coronary artery bypass surgery might be necessary. What about alternative medicine? While some practices might help with stress management, which is good for your heart, it's vital to understand that no alternative therapy can replace standard medical treatment for ACS. Things like omega-3 fatty acids found in fish oil might have some heart benefits, but you should always talk to your doctor before starting any supplements. Remember, ACS is a medical emergency that requires proven, evidence-based treatments. Finally, and perhaps most importantly, let's discuss lifestyle and home remedies. After an ACS event, adopting a heart-healthy lifestyle is your best defense against future problems. This is your long-term treatment plan. It means quitting smoking, eating a diet rich in fruits, vegetables, whole grains, and lean proteins, and limiting saturated fats and sodium. Regular physical activity, as approved by your doctor, is also key. Managing stress through techniques like meditation or yoga can make a big difference too. Cardiac rehabilitation programs are fantastic resources that combine exercise, education, and counseling to help you recover and thrive. Living a heart-healthy life is a journey, not a destination. By understanding the risks, recognizing the symptoms, and committing to healthy habits, you can take control of your cardiovascular health. Taking these steps is an investment in your future. Thank you so much for watching and taking the time to learn about this important topic. If you found this video helpful, please give it a thumbs up, and don't forget to subscribe to our channel for more content on health and wellness. Stay safe, stay healthy, and we'll see you in the next video.